Welcome, family. In today's knowledge, let's talk about newborn first hours of life, newborn immediate care. Watch till the end as I talk about immediate tests and procedures done for your baby after birth and many more. Please subscribe if you haven't. Like and share. Watch my playlist. It is information loaded. Share and share. After months of waiting, finally, your new baby has arrived. Mothers-to-be often spend so much time in anticipation of labor. They don't think about or even know what to expect during the first hours after delivery. What newborns look like. You might be surprised by how your newborn looks at birth. If you had a vaginal delivery, your baby entered this world through a narrow and bony passage. It's not uncommon for newborns to be born bluish, bruised, and with a misshapen head. An ear might be folded over. Your baby may have a complete head of hair or be bald. Your baby also will have a thick, pasty, whitish coating, which protected the skin in the womb. This will wash away during the first bathing. Once your baby is placed into your arms, your gaze will go right to his or her eyes. Most newborns open their eyes soon after birth. Eyes will be brown or bluish-gray at first. Looking over your baby, you might notice that the face is a little puffy. You might notice small white bumps inside your baby's mouth or on his or her tongue. Your baby might be very wrinkly. Some babies, especially those born early, are covered in soft, fine hair, which will come off in a couple of weeks. Your baby's skin might have various colored marks, blotches, or rashes, and fingernails could be long. You might also notice that your baby's breasts and penis or vulva are a bit swollen. How your baby looks will change from day to day, and many of the early marks of childbirth go away with time. If you have any concerns about something you see, talk to your healthcare provider. After a few weeks, your newborn will look more and more like the baby you pictured in your dreams. Bonding with your baby, spending time with your baby in those first hours of life is very special. Although you might be tired, your newborn could be quite alert after birth. Cuddle your baby skin to skin. Let your baby get to know your voice and study your face. Your baby can see up to about 2 feet away. You might notice that your baby throws his or her arms out if someone turns on a light or makes a sudden noise. This is called the startle response. Babies also are born with grasp and sucking reflexes. Put your finger in your baby's palm and watch how baby knows to squeeze it. Feed your baby when baby shows signs of hunger. Medical care for your newborn. Right after birth, babies need many important tests and procedures to ensure their health. Some of these are even required by law. But as long as the baby is healthy, everything but the Apgar test can wait for at least an hour. Delaying further medical care will preserve the precious first moments of life for you, your partner, and the baby. A baby who has not been poked and prodded may be more willing to nurse and cuddle. So before delivery, talk to your doctor or midwife about delaying shots, medicine, and tests. At the same time, please don't assume everything is being taken care of. As a parent, it's your job to make sure your newborn gets all the necessary and appropriate vaccines and tests in a timely manner. The following tests and procedures are recommended or required in most hospitals in the United States. Always ask what is obtainable in your region during prenatal Apgar evaluation. The Apgar test is a quick way for healthcare provider to figure out if the baby is healthy or needs extra medical care. Apgar tests are usually done twice, 1 minute after birth and again 5 minutes after birth. Doctors and nurses measure 5 signs of the baby's condition. These are heart rate, breathing, activity and muscle tone, reflexes, skin color, OPGAR scores range from 0 to 10. A baby who scores 7 or more is considered very healthy. But a lower score doesn't always mean there is something wrong. Perfectly healthy babies often have low OPGAR scores in the first minute of life. In more than 98% of cases, the OPGAR score reaches 7 after 5 minutes of life. When it does not, the baby needs medical care and close monitoring. Eye care: your baby may receive eye drops or ointment to prevent eye infections they can get during delivery. Sexually transmitted infections, STIs, including gonorrhea and chlamydia, are a main cause of newborn eye infections. These infections can cause blindness if not treated. Medicines used can sting and/or blur the baby's vision. So you may want to postpone this treatment for a little while. Some parents question whether this treatment is really necessary. Many women at low risk for STIs do not want their newborns to receive eye medicine. But there is no evidence to suggest that this medicine harms the baby. It is important to note that even pregnant women who test negative for STIs may get an infection by the time of delivery. Plus, most women with gonorrhea and/or chlamydia don't know it because they have no symptoms. Vitamin K shot. The American Academy of Pediatrics recommends that all newborns receive a shot of vitamin K in the upper leg. Newborns usually have low levels of vitamin K in their bodies. This vitamin is needed for the blood to clot. Low levels of vitamin K can cause a rare but serious bleeding problem. Research shows that vitamin K shots prevent dangerous bleeding in newborns. Newborns probably feel pain when the shot is given. But afterwards babies don't seem to have any discomfort. Since it may be uncomfortable for the baby, you may want to postpone this shot for a little while. Newborn metabolic screening. Doctors or nurses prick your baby's heel to take a tiny sample of blood. They use this blood to test for many diseases. All babies should be tested because a few babies may look healthy but have a rare health problem. A blood test is the only way to find out about these problems. If found right away, serious problems like developmental disabilities, organ damage, blindness, and even death might be prevented. All 50 states and U.S. territories screen newborns for phenylketonuria, PKU, hypothyroidism, galactosemia, and sickle cell disease. But many states routinely test for up to 30 different diseases. You can find out what tests are offered in your state by contacting your state's health department or newborn screening program. Hearing test. Most babies have a hearing screening soon after birth, usually before they leave the hospital. Tiny earphones or microphones are used to see how the baby reacts to sounds. All newborns need a hearing screening because hearing defects are not uncommon and hearing loss can be hard to detect in babies and young children. When problems are found early, children can get the services they need at an early age. This might prevent delays in speech, language, and thinking. Ask your hospital or your baby's doctor about newborn hearing screening. Hepatitis B vaccine. All newborns should get a vaccine to protect against the hepatitis B virus, HPV, before leaving the hospital. Sadly, 1 in 5 babies at risk of HPV infection leaves the hospital without receiving the vaccine and treatment shown to protect newborns, even if exposed to HPV at birth. HPV can cause a lifelong infection, serious liver damage, and even death. The hepatitis B vaccine is a series of 3 different shots. The American Academy of Pediatrics and the Centers for Disease Control, CDC, recommend that all newborns get the first Hep B shot before leaving the hospital. If the mother has HPV, her baby should also get a hepatitis B immune globulin shot within 12 hours of birth. The second Hep B shot should be given 1 to 2 months after birth. The third Hep B shot should be given no earlier than 24 weeks of age, but before 18 months of age. Complete checkup. Soon after delivery, the following is also checked and measured. Measure the newborn's weight, length, and head. Take the baby's temperature. Measure that baby's breathing and heart rate. Want to know more? Subscribe, like and share. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.